Hi, Julia. It's good to see you. It's been a while. How have you been?
Honestly, I haven't been great.
Oh, well, I'm glad to see that you're here. Why don't we talk about what's been going on?
I noticed the last time I saw you, I wasn't smoking anymore. I was able to use all the techniques that you showed me to quit. I was doing really well. My job started to become really stressful and money has been a little tight. I just couldn't handle it anymore. I started smoking again. It's just frustrating to be in an environment where I'm constantly surrounded by coworkers taking extra breaks to smoke. I just felt left out.
It seems like you've been in a bit of a stressful situation lately. Can you try and pinpoint for me around the time that you started smoking again?
Well, I hadn't smoked in 8 months, but I had my first smoke about 2 weeks ago and still carry my pack with me. I feel the need to have it on me. Even if I don't smoke, I just feel more secure. But recently, this has helped me getting through my days.
It's good to see that you were able to come in for help, and I appreciate you telling me all of this. I know it must be difficult with everything going on. So now that you're here, it shows me that you care about getting back on track. So we can work on things together to try to reevaluate your goals.
The most important thing to me is my family. You already know I have a young daughter at home who just doesn't like it when I smoke.
Yeah, I remember she was a big motivation for you to stop the last time. I think that it'll be good for you to focus on her, and can you think of anything else that would motivate you to want to stop smoking?
Well, I've also been struggling with other health issues like high blood pressure, and the past 6 months without smoking has really improved my numbers. I'm just disappointed that I wasn't able to stick to our plan. I just feel like I can't do it.
Okay, so let's talk about our plan from last time. What were some of the things that worked for you and something that didn't?
Knowing my triggers really worked for a while. But once work got really stressful, I wasn't really comfortable with my environment and I fell back into my old habits. It was just easier to light another cigarette since all my coworkers smoked.
Yeah, I understand that work can be stressful sometimes. Have you tried any other methods of stress relief?
Last time we spoke, we talked about increasing my physical activity level and spending more time outside of work doing things that I enjoy. That seemed to work for me.
That's great. If that worked for you, I would definitely advise you to keep doing things like that.
I really want this to be the last time that I have to go through this whole quitting process again and just be done for good. It's really taking a toll on me and especially my relationship I have with my daughter.
Well, I'm glad to hear that, and I'm here to help in any way that you need. How confident are you that you can continue using these techniques on your journey to quit smoking?
Honestly, not really that confident.
So, on a scale of 1 to 10, where would you place yourself right now?
Probably around like a 6 or like a 7.
Well, I appreciate your honest answer. Maybe we can add another element or two into the plan. Would you ever consider nicotine replacement therapy?
What's that?
It's a medically approved way to take nicotine by means other than tobacco. It's used to help with quitting smoking or chewing tobacco and things like that. And it increases your chance of quitting by 55%.
Wow, now that you mention it, I have a few friends that told me about that. It seems to work for them.
Yeah, it's actually a very common way to quit smoking. And there are patches that you can wear, even gum that you can chew that will help decrease those cravings for you. So let's work together to create 3 short-term goals that you'll be able to attain within like the next 4 weeks or so.
Okay, I think I can do that. That sounds great. What do you have in mind?
I want you to think of 5 reasons that you want to quit smoking. And I know this sounds repetitive, but I want to make sure that you remember why you stopped smoking in the first place. Next, I want you to identify 5 of your triggers that would increase your likelihood to start smoking and try to avoid those as best as you can. And I know that's going to be difficult, but we can take it slow. And then lastly, I want you to surround yourself with supporters and create yourself an environment where you're likely to succeed. It's really important to have support during times like this.
All of these seem very reasonable for the next 4 weeks, especially despite my busy work schedule.
I also want you to remember that this isn't something that's going to happen overnight. This is a process. Focus on taking it one day at a time and know that every day is just another step for you to become who you want to be.
Thank you, Nurse Jules. I'm so excited to meet you in a few weeks.
It was a pleasure talking this through with you, and I'm excited to be working with you through this journey and hopefully seeing you reach and maintain your goals.
The interview began with the client, Julia, in the relapse stage, and with the help of the nurse, she was able to re-enter and progress through the model of change. This interview showcased how fluidly someone can move through the stages and how they can recover from relapse. The nurse was able to facilitate this by establishing that this process was a partnership in which the client and the nurse were meant to collaborate in order to reach the client's goals. She also made sure that the client was able to find their own reasons for quitting smoking instead of controlling the conversation and giving her the answers. This ensures that the client will be more likely to be motivated to make changes and more likely to maintain those changes. Throughout the interview, the nurse was able to use core skills of motivational interviewing in order to help the client move through the stages of change and establish new and improved goals. The most frequently used skill was the use of affirmations, such as, "I appreciate that you're willing to talk about this with me," in response to the client's admission that they had started smoking again. This, along with many other examples, allowed the client to recognize the efforts they've made towards progress and build up their confidence to once again take action. The nurse also used open-ended questions to facilitate an open and productive conversation. At the conclusion of the interview, the client had moved from the relapse stage to pre-contemplation to contemplation and finally to the beginning steps of preparation. The nurse assisted the client in establishing 3 short-term goals that would be reassessed in the follow-up interview. Those 3 goals were 1, finding 5 reasons to quit smoking, 2, determining 5 triggers and how to avoid them, and 3, establishing a support network.
Good morning, Julia. It is nice to see you. How have the last 4 weeks been?
Good morning. I'm better, but there's definitely some room for improvement. I was able to create the 2 lists regarding triggers and reasons to quit. It's just helpful to keep them in my pocket, so as a reminder like why I should not smoke. But I'm still very stressed out about work and money being tight, especially at this time of year. The holidays are around the corner. I just want to give my daughter the best Christmas she could possibly have.
I appreciate you taking the time to come meet with me today despite of your crazy schedule at work and at home. Yes, this time of year can be very stressful for many people, but I was reading your chart from a couple weeks ago and I saw that you came up with a plan with Nurse Jules. Can you talk to me about how that's going for you?
Honestly, I've been struggling to find some time during the day to do a lot of physical activity. I'm always so busy with my daughter and my commute to work is spent on the train. I also haven't been able to surround myself in a positive environment because my family lives 45 minutes away and the only environment that I'm really in throughout the day is at work, and work is already stressful. Nurse Jules recommended nicotine therapy with gum or patches, and last time I went to Walgreens, I actually saw them around over the counter. I was so amazed at what she was telling me that I actually ended up buying a pack.
That is very impressive that you're taking the initiative to actually wanting to quit smoking because it's not always easy, especially with all the stress in your life. What are your thoughts on the patches?
I honestly think that they're helping. I remember last time I spoke to Nurse Jules, I said that I had to keep my pack around me because it just made me feel more comfortable. But now there's days that I go on the train, I don't even I forget I don't have my pack on me, and the patches seem to be working.
You're clearly making progress, and I really hope speaking about it, it helps you realize the progress that you're making within the last few weeks. Let's continue to use the patches, but I know money is tight at home, so let me see if a physician or even an APRN can write you a prescription for the nicotine patches. That way you don't have to stress about buying the patches. Why don't we talk a little bit more about surrounding yourself in an environment that can make this process a little bit easier for you? I know you mentioned family living far away, but what about any close friends?
Actually, I have a really close friend. She stopped smoking a while ago, and she was using the patches. We don't really talk every day because we have really busy schedules, but sometimes we get to see each other once a week.
I can help you find support groups that you can attend once a week with your friend.
I think that'd be a great idea. I'm sure my friend will be willing to come with me.
Can you tell me the last time you had a cigarette?
Probably 2 weeks ago. The first 2 weeks were really hard and I tried my best, but I gave in after 2 weeks.
I appreciate your honesty, and remember, this process is not easy for anyone that's going through this. It takes a lot from an individual to actually take the initiative to quit smoking. Let's talk about some positive reinforcements that can help you through this process to remind yourself that you're doing well. Do you have anything in mind that you would like to do?
I can't think of anything right now.
That is fine. What about putting money that you would have spent on cigarettes into a jar every week? At the end of the week, you can use that money to take your daughter out for dinner or something like that.
I really like that idea. I think it would motivate me a lot because seeing her happy makes me happy. She would be really proud to see me not smoking through this process.
I know you had mentioned that you didn't have the kind of support that you would like, so I encourage you to attend the support program and meet with them at least once a week. That can help you guide you through this process.
I definitely think I can do that, especially because everyone who attends kind of has the same goal.
Absolutely, even though everyone might have different reasons as to why they want to quit smoking. Can you please talk to me a little bit about the goals that we mentioned throughout this interview?
My goals for the future is to continue to not smoke by utilizing the nicotine replacement therapy. I want to reward my positive behavior by putting money into a jar and trying to join a support program and meet with them at least once a week.
That sounds great. It is clear that you're determined to change your behavior, so let's schedule an appointment for about 12 weeks to meet again and discuss about your progress.
Thank you for all your help. I really appreciate you listening and your support. I really hope I can do the best while sticking to my goals.
We will be here for you, and never hesitate to give us a call if you ever need any additional support.
4 weeks have gone by since the initial interview, and now Julia has entered the contemplation phase. With the suggestions from her nurses, both Jules and Zyra, they were able to aid in planning out her transition into the action phase. Throughout the interviews, it was evident that Julia moved through the phases of change. Both nurses were successfully able to build a trusting relationship with their client. Julia was asked open-ended questions, and this allowed her to freely express her own feelings. With new motivations and attainable goals, she is now able to try new ways to achieve smoking cessation. Julia was always given affirmations for coming to meetings and making a valiant effort to stop smoking. Affirmations encouraged Julia to keep trying to end her unhealthy habit. By the end of the interview, she became confident in herself to try again to stop smoking, especially while using the nicotine patches, going to support groups, and saving the money that she would normally spend on cigarettes to save for herself and for her daughter. The nurses used reflection as an interview skill as well. It helped Julia reflect on what she had said and helped the nurses capture a full understanding on Julia's problems. Each nurse used the tool of summarizing the client's goals. Nurse Zyra helped Julia to think of goals while suggesting some new ones as well. While summarizing, Zyra was also able to use the teach-back method too. The teach-back method was a great way for Julia to reflect on possible interventions that were provided by Nurse Zyra. In conclusion of the interview, Julia moved into the preparation phase and action stages of change, and now working toward the maintenance phase, and will hopefully continue to remain smoke-free.
That's a good idea. I just got it. We're just gonna run these and then just give a thumbs up. Okay, ready?
What about, wait, can I slide in on a chair?
Like this?
Yeah.
And give a thumbs up, and then we'll run in the back.
Okay, wait, do we start?
Three.
Perfect.